Hi, welcome to Healthcare Hoax. I'm Janet Cimorelli, licensed nutrition counselor. I'm here with Dr. Herb Slavin, an expert in functional medicine. And you can find us easily by going to healthcarehoaxvideos.com. That'll take you right to our YouTube channel. And at our YouTube channel, you'll be able to subscribe. When you subscribe to Healthcare Hoax, you're going to find the information about when the latest video has been posted. And don't forget, like our videos, share our videos with families and friends. And today, we're talking about a health crisis. Very important for the kind of information we're about to share with you, where you might be misled when visiting your doctor. Dr. Slavin?
Well, when you go to a doctor with a head cold, a chest cold, a sore throat, an earache, he spends about 5 minutes with you and he'll give you an antibiotic and get you out of the office. And the question that needs to be asked is an antibiotic really necessary? And you need to realize antibiotics are not a benign type of medication.
Wow.
There are consequences to taking antibiotics. And did you know that the majority of antibiotics used in this country are used in livestock? I used to say, how do you get antibiotics without a prescription? Eat chicken, eat meat, they're all loaded with antibiotics. And that's because of the way they're raised in these industrial livestock pens. But they also say, I think, that it makes the animals grow a little bigger too, I think.
Right, it makes them grow bigger and it makes them mature and grow faster. So it's used certainly as a benefit to the livestock producers. And unfortunately, because the livestock are so over-medicated, that carryover to humans poses a problem. What are some of the health problems associated with that exposure to antibiotics?
Well, primarily, there are a couple of factors. The first one is most infections, you go to the doctor with a viral, and the antibiotics are not going to be helpful.
Sometimes the doctors say, though, if we don't treat this, the bacteria are going to have an opportunity to flourish. Yes, this is a viral infection, but it's moving toward a bacterial infection. Is there any validity to that?
Yes and no. If I would normally just wait until you have evidence of a bacterial infection. But what will definitely happen is an overgrowth of yeast if you take antibiotics inappropriately.
Unfortunately, I see so many individuals who are struggling with that overgrowth of yeast. The other thing is, after taking the antibiotics, either knowingly or unknowingly, isn't it a problem for digestion?
It can disrupt the normal bacteria in your digestive tract, recently called the microbiome, which is not a good thing, but there are more serious consequences. There's one category of antibiotic I think that should be avoided at all costs because and be reserved for life-threatening illnesses, and those are the fluoroquinolones like Cipro and Levaquin, because they cause a lot of problems, including mitochondrial dysfunction.
Wow.
Chronic fatigue.
Okay, when you say mitochondrial dysfunction, it's the energy factory in every cell. And so if you disrupt that, the potential to energize all of the systems of your body can be compromised.
Exactly. And one of the tissues that have the most mitochondria is the heart. So if you damage the mitochondria, you're affecting the heart muscle as well.
Well, it's important for everyone to understand that the first response to an invading microorganism, the first response to a threat to your immune function is in your colon chemistry. And you're disrupting that colon chemistry when you use the antibiotics. The point that I tend to really focus on with people that I am doing counseling with is when you disrupt the probiotic profile in your gut, you will not necessarily be able to beneficially metabolize all of the B vitamins. Proper gut chemistry is necessary for that absorption and utilization of B vitamins.
All right, and back to the fluoroquinolones like Levaquin and there's Avalox and Cipro. The drug companies did a really good job telling doctors how great these antibiotics are. They're very effective for a broad range of problems, but they also create a lot of problems. So if you have an infection and you have other choices, other antibiotics you can use, you should try to use those and stay away from the Cipros and Levaquins.
Okay, and from my perspective, pay attention to some of the home remedy kind of things. Chicken soup, lots of garlic, and keeping yourself warm, getting enough rest, making sure that you have enough fluid intake so you can flush out bacteria and viruses that are threatening your good health. You've been watching Health Hoax videos. I'm Janet Cimorelli. Dr. Herb Slavin, functional medicine practitioner for many years, shares the concerns here with overuse of pharmaceuticals and neglect of natural approaches. So when you tune to healthcarehoaxvideos.com, you'll come right to our YouTube channel and you'll be able to subscribe. That will give you the opportunity to receive a notice when a new video is posted. And don't forget to share our videos with your family and friends, and to keep in mind that we are here about health, supporting your good health, and keeping you very well informed so you don't necessarily fall victim to healthcare hoaxes. Thanks for watching.